Okay, I'm recording. Dr. George, I'm happy to say Dr. George because we've done a bunch of podcasts when you're still just a young buck in the naturopathic school and not quite finished your boards, but now you're all graduated, finished, aced your boards, in practice, seeing people. How does it feel?
Yeah, it's been quite the journey. I remember sitting in this very seat several times in the last couple of years, talking about a variety of things, and since then things have changed substantially, I guess, for myself, right?
Yeah.
Like you said, did the boards. It was a very stressful time in my life, that's for sure.
Really?
Yeah.
I didn't mind them.
Well, I was going through a separation. My engagement ended, so...
I was kidding. Obviously, boards are tough. You went there, eh?
Yeah, so there was that part in my life that was rather difficult, but nevertheless, I think it was a good point in my life, getting through that. Never look back.
Dang, man, you went honest first minute.
Yeah.
Since I'm being honest, I'm going to move your camera over. I want you perfectly.
Yeah. I'm all about being vulnerable and being honest and being open. I absolutely love it, and so the
ladies like it.
And as we fast forward to today, I've been practicing now. I'm absolutely enjoying it. I love working with people. I love doing podcasts with you, and so here we are, present day, Dr. George and Dr. Jason going at it once again.
And today's topic is men's mental health. Well, you already kind of prefaced it a little bit. We're all dealing with things.
Absolutely.
Do you find that men have a hard time with their mental health, expressing themselves?
100%.
I knew that was the answer. And why do you think that is?
I think that's a great question. And I think there's multiple ways of dissecting that. First and foremost, I think society has created a condition where men are supposed to not be expressive in their emotions, not talk about their feelings.
Is that an artifact of the past? Or do you feel like that's still being sustained? Because you would think that with all the encouragement to acknowledge and address mental health, is there a gender bias still?
I would say so.
Is that, and I guess again from there, is that something from
evolutionary? You mean, or
well, I mean, we could go there. I when I think about the idea of like men should suppress their feelings, that's kind of like a macho, old school, like our grandfathers never sat around the fire crying. They just got to work and did what they had to do. It doesn't matter what their feelings were. They had to like sweep it aside because it wasn't manly. And maybe that has changed, and maybe that's not what we promote, but it might still be softly encouraged or still part of our culture where perhaps like let's take an example. Let's say we're playing basketball and your team beats my team in the championship. You guys are celebrating, I might be like devastated and crying. And if I'm really crying, you might be like, what's wrong with this guy? So maybe there is a little bit of like an innate like discouragement from showing that kind of degree of emotion because someone could be hurt and, it's like, suck it up. Where other people will be like, no, you should be able to show your emotions. Yeah,
and I would agree with you. There is for sure a degree of innateness for, I think, men, generally speaking, to suppress their emotions. And I think that's a big problem.
And why is it a problem?
Because we should, when I say we as in men, again, generally speaking, should be able to express their emotions, be vulnerable, be able to talk about anything that's on their mind, cry openly. I think it just speaks volumes to their character and their personality, if that makes sense.
Makes sense. But what's the alternative? Like, what's the impact of a man not showing his emotions?
So the alternative is, again, in my opinion, where generally when we are not expressive of our emotions, regardless if we're man, female, or anything else, right? A lot of these emotions, feelings that are suppressed can create a variety of disturbances in the body, physiologically, mentally, right? It can lead us down a path of mental disturbances. It can create a lot of issues in the gut microbiome.
Okay. That's interesting.
Mm-hmm.
So you're tying in a suppression of emotion with like physiological issues, not just like developing mental health concerns or conditions.
Exactly.
Do you have an example, like a specific example? Like, I mean, I am of the same opinion, but I'm curious about what your experience is.
In that regard, like from like clinical case, you mean, or just?
Suppose someone is suppressing their emotions. What could they experience physiologically?
So if someone's suppressing their emotions, physiologically, it could be a variety of illnesses.
Mm-hmm.
There could be issues with bowel movements.
Mm-hmm. Hence IBS.
IBS, yeah.
Right.
And we know that a lot of people who have had adverse childhood experiences, as one example, are more susceptible to conditions like IBS, CED, and other gut disturbances.
Okay.
Yeah. There could be issues with sleep.
Yes, that makes sense.
Mood, of course.
Yeah, grumpy guys all over the place. That's
right.
True. Road rage.
Road rage.
That's one of my questions I ask now.
Do you have road rage?
Yeah.
In your workup? No,
just at a club.
What?
Hi, what's your sign? What's your road rage level? No.
So how does that when you ask that question? How does that conversation go?
Because I usually have an intuition that they have some kind of brewing anger or frustration.
Mm-hmm.
And so when you ask someone straight up, like, oh, do you have any anger issues? No, I'm fine. Like they think it's actually like, if I say yes, he's going to think that I have like sociopathic tendencies.
Mm-hmm.
But if you ask a question in like a somewhat sideways angle, anyone could express road rage. Like you honk the horn a little loud or too long, you flip the bird, you swear, you curse under your breath. Those seem to be a little bit more acceptable levels of frustration and anger that people are like, actually, and especially it's when they have like a partner, like their wife or someone with them.
Sure.
And they'll be like, yeah, just on the way here, and someone cut him off and he went mental. And it's like, well, I'm not normally like that, but I hate bad drivers. So I use that question as a segue to be like, okay, do you feel like you have internalized rage that you can't let out because there's certain situations that you're not comfortable saying, like, I hate my job and I hate my boss, but I need my job. I can't tell my boss off. He'll fire me. So every time I go into work, I just blare the horn on. And if it turns green and they don't peel off until they go. So it's a way for me to gauge their aptitude for their frustration level. Other times I'll also ask, do you get irritable if you're hungry? That like hanger idea. Because that's also like an emotional thing, but tied into a physiological state.
Right.
There's like some dysglycemia, blood sugar stuff going on too.
The road rage, that's actually a very interesting question of how to approach that. Because typically I find with my initial intakes, and as I'm going through the questions, I do touch on mental health. And a lot of the times, a lot of people say, no, I'm fine. Or if I'm asking for anything like anxiety, depression that runs in the family, there's often no. And then more often than not, if indicated, we dive into childhood, because I'm a very firm believer that everything derives from childhood as it pertains to mental health as we become adults. And so, again, more often than not, when we explore childhood, we can see many, many micro traumas happening, right? There's potentially adverse childhood experiences that are happening.
What's a simple example of a micro trauma?
A simple example of a micro trauma?
Like bullying,
hearing your parents argue, right?
Isn't that normal?
That's a great question. Is it normal? I think for sure it's, I guess you could say it's normal, but I think as a couple from the parents, they have to be cognizant of who's around.
Yeah.
Right? Because of course they're going to be arguing, there's going to be disagreements, but if you're raising your voice and it's just a constant thing that you're doing in the presence of your children, they're going to pick up on that energy, right? And this is going to affect them.
Yeah. And it's interesting because siblings will have a different experience of that. One will be like, I don't really remember mom and dad fighting. And the other one will be like, I can't even, like, if they start saying something in a louder voice, I get flashbacks with dad did this and mom said this. And it's like, did we not grow up in the same household? But one just didn't pay attention, didn't care, didn't faze them, or it's suppressed.
Yeah.
And then the other is like, no, this was like a major. I talk to my therapist about this all the time.
Mm-hmm.
So I feel like siblings don't always perceive things the same,
Of course.
even though they were like present.
Yeah, I would agree. Yeah.
So that's another factor,
Mm-hmm.
like character, birth order, gender.
Yeah.
These are all things that affect how these micro traumas, I think, affect us when we're older.
Even in, I'm reading a book called The Honeymoon Effect by Bruce Lipton. I don't know if you're familiar with him.
Sounds interesting.
It is actually quite interesting. But in the book, he talks about, I just started it, but he talks about mental health and trauma, and he even talks about the importance of in utero. And in utero, while the fetus is still growing, things like hearing from the outside world, people yelling, can affect the baby in utero as it grows.
How did he show that?
That's a great question. And there was a study that was done, and I just can't think of it right now.
That's okay.
Hopefully, it comes
You
back.
paraphrase. It's okay. But there's studies that show, I guess, kids that maybe they seem like these are questionnaire type studies.
Yes.
Like, do you recall your parents fighting, or were you what was your level of frustration during your pregnancy, and
Mm-hmm.
and like big numbers, population studies, I'm sure can lend itself towards trends where it's like, okay, people who have like OCD, they have a tendency to, they had scored higher that they had X, Y, and Z happening.
Yeah.
Interesting. So with your patients, especially with men, how do you get them to acknowledge their mental health? Like, because you probably could perceive that there's something going on, whether they're aloof about something, dismissive, overly protective, or even if they are, open to addressing it. Well, how do you bridge that?
Typically, from my experience, again, I find most men reluctant to talk about mental health. It's almost non-existent when you bring up the idea of, describe to me how you're feeling, emotions, childhood, trauma, being vulnerable, all these things. There's almost like a hesitation and a reluctance, again, from my experience. But I think with the right, probing, and after you get to know your patients, a lot of them just kind of tend to open up, depending on how the relationship has been established.
Yeah. I think that's important.
But it's tricky. I think it's tricky. It's not an easy area. I think of folks that I'm extremely passionate about, and I love doing it. I think because when men start opening up that door of healing their traumas and really starting to be expressive with their emotions and being vulnerable with their partners, it opens up a door of joy, of happiness, of excitement, something that a lot of men haven't experienced and didn't even know is possible.
Yeah, maybe that's it. Maybe they don't know that they could just be happier if they let go of their hurt, or even acknowledging it, as opposed to being like, well, just, these things happen. What do you want me to do about it?
Exactly.
That's interesting. Do you find that men have a better or worse outlook on life compared to women?
In what domain?
I mean, I could say any domain, but like overall, do men ever, like, of the patients that you see, I don't know if you can do a percentage, but like, is there a bigger aspect of mental health showing up with your female patient? I mean, maybe more obvious.
Yes.
Maybe they're specific with their concern.
Yeah.
Maybe in their review, they're like, I get anxiety, I have depression, I have a history of this. Or men tend to just like, no, that doesn't apply to me.
Yeah.
I guess what I'm asking is, do you think men experience anxiety and depression at the same level or frequency or depth as a woman may? Feels like a trick question.
Yeah.
It's not a trick question.
No, I would say yes, if not worse.
Really?
If not worse.
Because okay, I get that. I get where I think there's always gender differences, and it doesn't mean that one doesn't have something and the other only has it. But it could be like most women feel some type of anxiety or depression, but it's manageable on average, whereas most men don't experience it. But those who do have it severe.
I would say most men do experience it as well.
Okay.
I would say most men do. And I think...
I guess my question is, if you don't know that you have it, does it affect you still? These are deep thoughts.
They are deep thoughts. That's a great question.
Wow. It's an NPlex question.
Yeah.
Oh, you don't do NPlex anymore.
No.
That's a Kono.
Kono question.
I don't know.
Yeah, I don't know the answer to that, right? I think a lot of men know something might be, I don't want to say wrong because wrong is not the right word. Something might be, they might feel different about something, right? And perhaps it just push it aside, and pushing it aside, right? And over time, that accumulation of suppression is going to manifest itself in, like you said, actually, severe anxiety. So that I can see now how that's kind of come full circle in a way, right?
Yeah, maybe because they are more likely to suppress and bury.
Yeah.
Where it gets to a critical mass where it explodes.
Yes.
As opposed to someone who's more in touch with their emotions on a general level, they perceive it and address it maybe more frequently, or more their tolerance is less. So like I can't function. Like I need to address my subtle anxiety, whereas someone would be like, only until it became crippling did I actually acknowledge that I had it. Yeah.
And I think that's actually quite true to say for men.
Because men are like that for every condition.
For anything. And it doesn't have to be about mental health. It could be about a sickness, a
pain,
cough, anything.
Diseases,
no wait till
heart attack. I'm like, I'm still walking. Yeah. It's like, you had a heart attack. It's like, yeah, but what do you want me to do about it now? It's done.
Right.
It's like, well, you got to do these tests. You got to take medication. I don't want that. And I only had one.
Yeah, and I think that's as you said, it's generally true for anything. There's this need to just suppress when it comes to not only mental health but physical health and all that.
So would you say that's a male trait?
I don't know if it's a male trait.
Sweeping something aside.
I don't know if it's just it's that simple. It's very simplistic to say. I guess it's a male trait.
I don't dislike men.
Yeah.
It's not that I mean, because we're both in practice, and there's lots of times when a man comes in, and the fact that they come in, they're already opening the door a little bit. Often I'll get a female patient. She'll be like, I've been begging my husband to come and see you. He doesn't buy this kind of thing. He doesn't think this is like real. I'm like, okay, well, just tell him like food's real. And if his eating habits are not great and he wants to eat better, that's what I'll discuss with him. So that's real. It's not like I'm asking him to make a potion. It's not like I'm asking him to chant something. This is something real.
Of course.
So men tend to want to be like, they don't like this foofy stuff, but foofy meaning like emotions, or how do you feel about something, like what you're highlighting. It's like, it's more of a black and white. It's like, oh, what's my cholesterol? It's under 5. Well, all right, why am I here? Okay, but I mean, I'm very curious about the idea of mental health leading to physical conditions. Do you have any thoughts on that? I mean, we touched upon it earlier about the IBS.
Yeah, for sure. I think there's IBS intertwined. I mean, we know the gut-brain-mind connection, right? There's this bidirectional pathway between the brain and the gut. And so, again, the mind, I think, is quite powerful, right? Thinking about thoughts can perhaps cause inflammation, right? If we talk about epigenetics, I don't know if you're familiar with the words of epigenetics. Again, Bruce Lipton and other doctors. I think it's science that's exploding in a way where now it was once thought where genetics played such a big role on illnesses, and if you have these genes encoded or mutated, you're going to get this pathology, etc. But as of late, I think it's less than 5% of what your genome is, and then what manifests into actual illness.
Yeah, I think you're hitting it on the head. I think the genes are the predisposition, but the nurture or the environment is what can escalate or activate those genes. So if someone is negative emotionally, maybe they feel frustration. Now, I like to tie in emotions with organs. In TCM, it does a great job. Yeah. The idea of being hangry, to me, is blood sugar. Blood sugar is regulated by the liver, pancreas, insulin levels, and that kind of resistance can lead to impairment of how those organs are functioning. And then it shifts your gut biome, because if you've got dysglycemia, you got higher blood sugar variability, your gut biome is going to change. Yep. You're going to have more of the gut bacteria that likes high sugar. Now you're going to find that you're craving sugar more often. You're going to find that you're pulling into Timmy's and getting a double and a half a box of Timbits or whatever it is. Yeah. And you're like, why did I do that? I didn't even want it. And you're just like, and you're downing it. And you're like, oh, I feel terrible when I have it. It's like your behaviors have changed in response to a physiological state. But that physiological state was triggered perhaps by an emotional state. Stressed, anxious, irritable. I need a sweet. I need something. Yep. Changing my gut, changing my routine, changing my habits. I like that. Mental health.
No, I would entirely, I would completely agree, rather. And I think traditional Chinese medicine has a beautiful way of mapping out the organ systems and pairing them with certain emotions we feel. And you mentioned a great example of this glycemia, the liver, the insulin. I
like looking at. I have a saying where, excuse me, I have a saying where in regards to TCM, the kidney is the weak organ in the man. And the liver is the weak organ in the female, because the liver has more of an impact TCM wise for its function in a woman because of her cycle and hormones, whereas a man is a little more of a basic organism that it's just more like energy function. And so that's where the kidneys come in. So I like using that concept of like, men are more prone to issues of the kidney system than liver.
And have you seen that in practice?
Repeatedly. I find men have more kidney issues. Women will have more offshoot of the liver function. So if we literally can break down the body into the 5 main organs in TCM: the lungs, the liver, the kidneys, the heart, and the spleen. There's a large intestine. One of those, spleen. Yeah. And I like dividing the body up into that. So then when you see a bunch of symptoms in one of those organ systems, that organ is failing in some way. And then from there, all these emotionals come from there. So you start seeing a picture of it's like a stereotype or a caricature of this person, which in TCM, it's full of that. It's like the water type and then the earth type, and all those, that stuff. So men tend to have kidney stuff because men kind of have this thing with like courage, motivation, drive. And if the kidneys are weak, they're frail. They don't have strength. The frailty is not just physical, it could also be mental. Because men tend to have a higher degree of dementia and earlier onset, right? Whereas women will have a lot more liver-related, more of a broader spectrum of conditions. They're more sensitive to different things. So there is a bit of a gender bias that maybe women have more conditions because of their upgraded firmware, right? They have more options. So they have more things that needs to be addressed. They can conceive. We can't conceive. A man, though, it's either working until it's broken. So sometimes I think some of it is innate, but that doesn't mean, just because that's a physiological state I'm implying, that doesn't mean that our male intellect should be limited in a way to think, well, I'll just keep going until I break.
Mm-hmm.
Why don't you adopt some of the female attributes?
Yeah.
If we're going to use these kind of terms of being more conscientious and proactive with your health, with your mental health, and like looking at your body in a similar way, but without the stigma of it being like, oh, why are you such a wuss? We're going to the doctor.
Mm-hmm. Yeah, and I think when you say stigma, I think in the realm of mental health, I think we've as a society we've come a long way in terms of accepting it and understanding it and being open about it.
Yeah.
However, we have a ways to go when it comes to mental health, especially over the last few years of what has transpired, right? And so as we talk about men's mental health again, it's just it's so highly stigmatized. I think for myself, as an example, when I'm having conversations with people, or if I've given a few presentations, I can openly say I go to therapy frequently. I can talk about my problems, my emotions. I'm very vulnerable, and I think when people, I guess men, get into that state of that being open and being vulnerable, you will just feel lighter. I mean, that's the simplest way to describe it, I think.
Would you say, I guess you would probably agree that seeing someone like yourself openly discuss that aspect of your life and your health would make it a little bit more viable and acceptable for them to pursue those avenues of like therapy, counseling, open discussion.
Like, what if I'm just talking to men?
The fact that you say it, you are like an example, making it more like, oh yeah, he does it. Oh, I could do it. Okay.
I think so. And that's my hope.
Yeah.
That's my hope, because I'm, again, a firm believer of kind of practice what you preach.
Mm-hmm.
And when I'm talking about men's mental health, I'm the first person to be a huge, firm believer in that it's very important. Again, like I mentioned, I go to therapy, and it's like almost maintenance too, right? If we look at, a lot of people think they go to see a therapist, a counselor, or whatever that is, if they're almost very stuck in a way mentally. But perhaps you are. But even if you're not, we go to the gym or we exercise to maintain our physical body. Similarly, we should be doing that with the mind. But what do we do for the mind? A lot of people don't do anything.
Well, I think that's a good question, because I mean, aside of like seeing a specialist or a therapist, like things on a daily basis, what could men do for their mental health?
In my opinion, I think the gym, exercising, is probably one of the best things you can do for your mental health.
Yes.
Aside from the physical benefits, of course. For me, at least, I find when I'm not going to the gym, my mental health suffers. And I notice that right away. I just feel different.
So, I mean, why do you think that works? Why do you think exercise helps with your mental health? Is it a distraction?
I don't think it's I think it can be a distraction, but if we look at it physiologically, we know when we're exercising, we're putting the body under eustress, right? We're getting those uptake of all those feel-good neurotransmitters, which we often see issues with in a lot of mental health disturbances, right?
Yeah.
If we take depression as an example, I think to help someone get out of depression, right? Whether it's a medication, whether it's a supplement, without prescribing exercise and proper nutrition, I think they're not going to get better. I think those are two important things in the realm of mental health.
I agree. The trick sometimes is motivation. Because a lot of times when you're down, the last place you want to be is at the gym.
Yeah.
And the second last place you want to be is in the kitchen.
And that is the single most common question that comes up in conversation. And because of course, when individuals are mired and ensconced in their mental health disturbance, it's very easy to tell them, eat better, exercise more. But if they can't get out of their bed, what do you do? So I would love to hear your take on providing them with that sense of agency again.
Yeah. I think it goes back to some of the things with organ dysfunction, because I find that adrenal fatigue, adrenal exhaustion, that organ itself is really poorly understood, and I think is we should consider it like our force field for everything. If your adrenal gland is strong, you will be less likely to become anxious or depressed. Cortisol has a huge impact on that processing of neurotransmitters and the perception of stress. So if you have great adrenal function, problems look like this because you have the resources to surpass it. But if you have very low adrenal function, these problems, now all of a sudden you're looking up at them and it's like, this is a mountain. I'm not going to be able to climb over it. So I actually, before they can go to the gym and before they can, start feeling better, I get them to start taking an adrenal tonic to stimulate and or to add in nervines, things that will help soothe the nervous system. So adrenal tonics with a nervine in it is a great combination because when you take it in the morning, it gives you a little pick-me-up. I feel like I can get out of bed. I got some things I need to do. I feel like doing them. And then when you take this same formula at night, you actually feel like my day is kind of coming to a close. I feel relaxed. I sleep deeper, better quality. And then when they wake up the next day, their adrenal gland has been recharged like their cell phone. You plug your phone in at night, you wake up, it's 100%. Ideally, your adrenal gland would do the same thing. And once you get good cortisol production, motivation starts to creep back in because your body has energy to burn. If it doesn't burn it physically, it'll burn it mentally. So when you burn your mental fuel, that's what keeps you up at night. Ruminating, thinking, stressing, planning, overanalyzing. So I like physical activity as a means to ground that overstimulation, that yang energy, and building up the yin, that idea of the yin and the yang, where yin is what's going to make you feel, balanced and grounded to the earth, whereas the yang is giving you energy, thought and creation. But you need a balance between the two. So too many people have poor nutrition or nutrition that is fueling yang, which could be like a lot of carbs, whereas protein is yin. So you got these guys that they have a lot of pop, energy drinks, simple carbs. They stay up really late and then they're sluggish. They don't feel like getting out of bed. They don't have drive. And then their cortisol paradoxically creeps in at night. Get a second wind. I'm on the computer. I'm on this. I'm that. I don't feel like sleeping. My mind's racing. And it perpetuates this thing where it's like you're like 6 hours out of sync with your body. So adrenals, that's where I would start.
Is there, when it comes to stress, because of course there is stress is highly subjective. If someone tells you they're stressed, well, how stressed can you be? And of course you could ask them on a scale of 1 to 10 as an example. And I think I was reading something, it constitutes maybe like 80 or 90% of hospital visits stress, right? Or something like that. But how do you measure adrenal dysfunction? What biomarkers are you using, if any?
I think it's really useful. I actually lean on the Konigsberg test, which is a in-house urine sample. So they provide a sample. I'm adding a couple reagents. I'm looking for a color change, and it's measuring chloride ion output as a measure kind of correlated to aldosterone and cortisol. So either the person is producing the right amount of this cortisol, they're either hyperproducing it in times of elevated stress, but their body's meeting those demands, or that has been going on for too long and they come in an exhausted state where they don't produce sufficient amounts. So that reagent is not showing any sample production of so it doesn't change color. That's what we're looking for. So it's a neat test because it's a visual for the patient. The urine, typically clear urine, yellow. You add the reagent. The first reagent is yellow. It's like a dye. And then we're titering in the last chemical, which is going to change color to red. It's a very clear change. And you're counting how many drops it takes. So something like 0 to 15 is hyper, 15 to 25 is normal, and then 25 and above means an exhausted state. Sometimes it gets to the point where it never changes color. Those people are bottomed out.
Wow.
And the truth is, whether you're in the hyper or the burnout exhausted stage, those are the terms that the person will use. They'll be like, I'm like really hyper right now. And then you measure their Konigsberg test, and it's like, yeah, you're like 2 drops, and it changed right away. It's like, yeah, I'm on edge. I'm doing it, but I feel like it's coming. And then other times it'll be like, I'm wiped out. And you're adding 35, 40, 45, 50, 55, 60. It doesn't change. I'm like, there's nothing there. Your resources are wiped out.
Wow.
So I like that test because it's in the moment. It's today. Some people are like, well, I did a cortisol blood test.
Like
my doctor.
The PM, I guess.
Sometimes doctors just do a random.
Oh, okay.
And it's like throwing a dart at the wall. Okay, it's 350. Yeah. What does that mean? Well, it's not 0. It's not 3,000. So I guess you're okay. 4-point cortisol is also a nice test.
On the concept of cortisol, what is your most favorite way of testing it? For sure AM and PM.
The 4-point cortisol is better.
Yeah,
it's better because you want to be able to see a transition from first in the morning, midday, evening. Mm-hmm. So you're doing 4 urine collections in that day, and the lab will give us like a graph. And so what it should look like, your cortisol should spike upon rising
in the morning,
because that's your natural caffeine. It allows your arteries to condense and make sure that when you go from horizontal to vertical, you don't collapse as soon as you step out of bed.
Exactly.
And now you've got blood flow and you got your body's organs are stimulated to function for the workday. And then throughout the day, this cortisol measure is dropping off and then starts to rise during the night and meant to refill over the sleeping hours. So when you wake up, you got that big rise ready to start your day again. A lot of times when people are really tired for a long time, they've got very low morning cortisol. Those are the people that are like, I have a hard time getting up out of bed in the morning.
Yeah.
And then they find it's like, yeah, but I get a second wind and like 2 o'clock, 3 o'clock in the morning, my mind's still alert. It's cortisol. We got to flip it. And that's why I like using like a Nervine that's a tonic, because it re-entrains the nervous system and the brain and the cortisol production so that it's high when you need it and low when you want to rest. That's what I would do.
Do you use, aside from those 2 tests that we've just discussed, any other biomarkers that you think are necessary in a mental health or mental health, or just mental health, generally speaking, workup?
General mental health, I like sometimes looking at neurotransmitters.
Okay.
I don't do it often, but I do use it if there's been a history of mental health, like depression, severe depression, medication use, drug use, anything like that, where these are things that could alter or like shift some of the parameters, serotonin or dopamine, or there's so many markers that we can look at now. A lot of them are like biochemical offshoots. So sometimes serotonin on its own, it's normal, but there will be like a subcategory of it. It's like, but this is kind of like getting shunted in. And then this is where some chemistry, you start learning a little bit about how the brain is utilizing certain things. And it doesn't always mean that you have to give them like serotonin or 5-HTP or tryptophan. Sometimes like I just end up going like, have a protein shake first thing in the morning. Fill your body with good amino acids, a good amount. Not just like, well, I had a half a shake and I had some toast. No, put 2 big scoops of a good protein powder and have that first thing in the morning. That huge amount of yin protein balances, it grounds you for the rest of the day.
Yeah.
And then it kind of just allows energy levels to taper off and sustain you the rest of until the evening.
Yeah, I really like, typically with patients, I will always do like a baseline biomarker workup.
Yes.
With a lot of the B vitamins,
okay.
vitamin D,
yes,
inflammation, and
CRP, ESR,
exactly. And it's not to say that these are causing the mental health disturbances. However, I think it's an important part of the picture, right?
Sure.
Because if there is inflammation in the body, if the vitamin D is low, if the B vitamins are low, and we adjust that through diet, supplementation, exercise, stress mitigation, techniques, that's a huge part of getting the person, going back to become motivated as well.
Yeah.
Right.
And that makes sense, because if those markers are low in the blood, they've probably been low for a while, because our body likes to compensate for things, and hides are where we lack. So if it's low, there's a nutritional severe, like something is like becoming compromised.
Yeah.
So those are individuals like, get started on a good breakfast, lunch, dinner routine. Throw in exercise. 60% of your patients start feeling better mentally. And it's not to undermine it. And it's not to say, well, you did this to yourself. But we are grossly underestimating the importance of a balanced diet when it comes to giving us our body resources to manage stress, to produce stress hormones, neurotransmitters. So if we are like starving ourselves of something that's critical, of course there's going to be a consequence to that. Who's to say that the mental health isn't the first thing that's to go? Yeah.
And I think diet too, and when I say diet, I just mean what we eat has like vast implications on our mental health, right? And I think the area of nutritional psychiatry, again, is an area that's exploding. There's a doctor out of the States, Chris Palmer. I don't know if you've heard of him. He's a heart psychiatrist, and he's done a lot of work in the nutritional realm of psychiatry, in that he's put patients who've had bipolar, schizophrenia, and other severe mental disturbances in which many things haven't been effective, as like medication, supplements, etc. And some of his patients he's put on a ketogenic diet, and he's reversed everything. Now, that's not to say that that's going to resolve everyone who has schizophrenia or bipolar, but I think it's an important thing to consider, because now we're seeing how important diet and nutrition is, not only for our physical health, but for the mind.
Well, I like that on a lot of levels, because amino acids in general have like a stabilizing neurotropic effect. Ketogenic as well, what it's doing is like it's eliminating the negative impact that carbohydrates have, and the overconsumption of carbohydrates, whether it's both like in a dysglycemia state and or with the gut health. Because I really believe that, my suspicion is that if there is a significant psychiatric condition, if you were able to analyze their gut biome, I think you would see a lot of strong correlation with similar type of bacterial infections. Yeah.
I would say so.
I have a feeling.
How do you analyze the gut microbiome?
Probably the typical stool analysis. I think where there's many out there. There's different labs.
Is there one that you specifically?
I like the GI map.
The GI 360.
Is that the new name?
Yeah.
It's one of those. Yeah. By
Dr. Stata.
Is it Dr. Stata?
Or in common.
Well, then it's through ICL.
Yes. ICL.
I like it. I don't know if I think it's a little bit more specific for gut health as opposed to mental health. There is something to be said about like H. pylori.
What do you mean?
I think H. pylori has a strong personality correlation. People who have H. pylori, I don't believe that you just contacted it by sharing a cup with someone who had H. pylori.
Right.
I don't buy that. It's commensal. Everyone has a little bit of H. pylori in their stomach. It's measurable. When I do the stool analysis, H. pylori is always there. It's only a problem if it's above a certain threshold and they're getting symptoms. But the people who have H. pylori, they tend to have an issue with injustice.
Injustice?
Yeah. Like they have a hard time. This is like empirical stuff I keep seeing, and every time either I'm at the point where like I can sense someone's talking a lot about like things that are not fair, and I'll ask them, "Have you had H. pylori?" And most of the time they'll be like, "Yeah, actually I have." Or they'll say, "I have H. pylori," and I'll be like, "Do you have issues with like the injustice in the world?" And most people will be like, "Yeah," but then they'll go into like, "But I'm actually volunteering with this society, and I go down to a third world country, and it's like there's meat there." And again, tying into like TCM, when the stomach and the liver are not in harmony. So the stomach is what's harboring the H. pylori. The H. pylori is responding to sustained elevated acid production stimulated by the liver, but in the context and presence of high glucose or carbohydrate. So all this sugar is in being present with all this extra bacteria that's an extra acid, which has changed the pH. So the environment in the stomach is more hospitable to this H. pylori. So now it's like, I got so upset. I was so irritated. It really burned me today. And my stomach, have you ever been so angry your stomach hurt? That's where this H. pylori phenomenon evolves from. And that's one of my clinical pearls.
That's a very interesting correlation.
Yes, it's a correlation. People would say it's not a causation. But I think that there's more examples that we're like that. To me, it dovetails well with like IBS, like someone who worries a lot and they got like alternating constipation, diarrhea.
Yeah.
Similar, but a little bit more of a specific, deeper psychological correlation there.
It actually jogs my memory. There was a patient that I had a couple of weeks ago, and he was a 15-year-old patient, and he's had chronic constipation since he can remember. 5 years old, and nothing has worked. Right, he's seen a variety of medical doctors, and they've just said it's IBS, IBS-C, and they've given him a magnesium supplement, didn't work. But other than that, there's really hasn't been more.
Is he on Restorelax?
Was it Restorelax? Is that?
If the doctors gave it, I'm certain it's Restorelax.
Yeah, it must have been. But there was obviously no more in-depth investigation. There seemed like there was no in-depth investigation. Yeah. So when we were having a conversation just about a general health, suppressed anger came up. And it was interesting how we transitioned into this when we were talking about exercise. He said, I hate exercise, I don't do it. I'm like, okay, is there anything that you like doing? And he's like, I have a punching setup bag in my room that I love hitting. And I'm like, okay, what?
That's worse.
What do you mean that's worse?
I feel like that will, even though people say like, oh, if I yell into a pillow or I punch a pillow, it gets my frustration, I feel better. But if that's your go-to when you're frustrated and you start hitting something, I feel like it perpetuates anger.
There's a lot of, I would agree.
I'd be like, can you go learn how to knit or something? Go do some cardio, maybe. Run off this anger. Don't punch through it.
I just found that interesting because as that conversation came up, like how this for sure ties into the issues that he's been having with his gut.
And I mean, constipation often is just like not letting go.
Yes.
So harboring and holding on to things like this happened. And I'm not going to forget. I'm never going to forgive, and I'm not going to it's never going to happen to me again. Like, it's like,
And I think that ties into general, as men's mental health as an example. Should they seek a therapist as an example? What if they talk about their emotions? If they go down that path, in my experience, they notice improvements in other areas of their life that they never thought would happen, such as improved sleep, improved digestion. Relationships with loved ones are just seemingly easier to communicate with, that type of thing. Those types of things.
Of course, it has to. Like, we're not a one-trick pony. We don't hyper specialize in anything. We're fixing all of you.
Yeah,
and it's hard for people to get that into their head because they're like, well, I'm not coming in for anything else. I just want this better. I'll be like, okay. And then 3 weeks later, they're like, yeah, it's better. And then this is also better. Did you give me something for this? This help with that and that? And I'm like, no, not really. But in the back of my mind, I'm like, yeah, of course it does. Because there's a little bit of a bottleneck somewhere and it was affecting many streams of function. And so people have a hard time thinking like, when even in school, a lot of times what we learn in school is like a condition and a treatment, condition and a treatment. It's like, but we are told like, you don't have people coming in with just one condition.
No.
I remember one patient came in, she had constipation. She came in, next time she came in, constipation was gone. I'm like, that's it? I'm better.
Wow, okay.
I'm like, is this weird? This is weird for me. Because usually people are like, yeah, this is better, but not this is. It's like that's sort of like there's layers.
Yeah.
This lady, she didn't share any more layers.
I mean, we're a complex organism, right? So
of course,
treating ourselves as like in this mechanistic approach where it's like we isolate pathology and we just treat that.
Yeah.
It's sure might fix that area of concern, but surely there might be others.
It caters to a train of thought of like, I just want to be better. Just give me a pill, make it go away. And it's like, it's way more complicated than that.
Yeah.
As much as we'd like to think that, since this happened, I've had this problem. We go back, we retrace it. Okay, I'm better now. And you start digging, you're like, this has been happening in some way, shape, or form since birth. Like the example you said with constipation.
Yeah. Sometimes
constipation is transient, and then you go through a phase like, oh, I'm better now. That's like, yeah, but you got eczema. Oh yeah, but I just put some cream on it.
Yeah.
And it's like that's a manifestation of your constipation going deeper internally.
Exactly. Yeah.
And my doctor never said that. I'm like, yeah, they're not going to. And don't tell them I said that either. Because he'll tell you I'm crazy.
Yeah, 100%.
And then some people are like, no, that makes sense to me. But I won't tell my doctor, though, just in case. Because then he'll think we're both crazy. Yeah. Yeah.
That's the truth.
So men need to be in touch with their emotions.
Men need to be in touch with their emotions. And I think a lot of why I'm so passionate about men's mental health, I think a lot of it was with my journey in which, as in the last 3 or 4 years, I really started to reflect on who I was as a person, right? I would start to look at why I'm behaving a certain way, or why is this triggering me? Why am I not able to tell people that I love them? Things like this, whereas I went through my whole life and I'm just like, this is who I am. Right? But only through, reflection and through therapy, lots of it, did I start to figure out why I was this way, right? And how I developed these, I guess, maladaptive behaviors as a child and how they transitioned into adulthood and thinking that they were fixed. But I think, personalities for sure are stable, but they're also amenable to change. And so if I talk about myself as an example, I learned why I wasn't able to tell people I love them. I learned why I had difficulty communicating my emotions, my thoughts, my feelings, and everything else. And then as I went through my journey, I'm like, wow, this is amazing. And I've changed so much, and I think in the last 2 or 3 years. And so part of that is I want to pay that forward. Oh, yeah. That makes sense. Have you gotten feedback from the people around you since you've been evolving? Extensive feedback. Extensive feedback. Lots of it. Were you expecting that, or were you surprised by that? I wouldn't say I was expecting it. Was I surprised? I don't think so. I mean, I put in so much work, right? And I think the people around me saw that. I mean, they my close family and friends saw the transition over time. Well, I mean, how different were you before? I've known you for a long time. I mean, give us a soft example of, you said telling people you love them, and maybe you couldn't do it before, and now you're probably telling everyone you love them. Yeah. And then it's interesting because me telling people I love them, when I give that example to friends and family, now I can actually see there's people in my circle that won't say it back, and it's I can kind of why can't you say you love me back? You ask them that? Well, I mean, in my head I do. You should ask them. You say I love you, and you're like, wait, well, and it's not coming back. I'm making an appointment for you. We're going to talk to my therapist, and I'm going to be there. I'm just going to watch, and I'm just going to listen. But I think as now I reflect on, I think, okay, something is going on there for you, right? Do you think it's always an issue of do you think just some people are just shy? No, you always think there's something there. You're broken. Well, I mean, broken is a harsh word. You're cracked. I think some people for sure can be. Has any of your friends be like, okay, dude, yeah, we love you, okay? Because saying we love you versus I love you is very different. Have you seen that? What do you mean? If someone is with someone else and be like, hey, you know what? We love you.
is very soft in comparison to like, you know what, dude, I love you.
Oh, yes. Because I personalizes it.
Yes.
Similarly, like
we is like, yeah, the whole world loves you.
Yeah, like if you,
big deal,
right? If you're your partner, and you tell them a lot of the times in a relationship, whether it's a phone call, a text, or you're leaving the house, it will be like a quick "I love you," and that's almost a pattern. And it's like, do you really mean that?
Oh, now you're hyper analyzing.
Well,
now you sound like a woman. Just kidding. Just want to see if you're listening.
Yeah. But I think when you just the simple insertion of "I love you" really changes that dynamic of that, and that's my opinion. Perhaps it is hyperanalyzing.
Yeah, and I'm worried. No. Do you find though? Do you like? I don't want to say it tongue in cheek. I don't want to make light of it. But do you find that you've had to stop yourself from overanalyzing cues because now you've become very acutely aware?
Yes.
Yeah.
Yeah, absolutely.
Yeah, it's like that person that didn't open the door for me. They obviously have mental health problems.
I mean, perhaps not to that extent, but yes, 100%. I found myself in situations where I am acute.
You didn't go back to your high school yearbook and be
No.
like, you know what?
No
I
way.
signed his. I remember. He didn't sign mine. Call him. You remember? Hey, let's meet.
But I think I have noticed that for sure.
Yeah. Okay. Now, let me ask you an outside of the box question. In a future relationship, what do you think you would be doing or saying or feeling differently? Could be any type of relationship. Doesn't have to get too romantic on me here.
In any new relationship?
Yeah.
Okay, well.
Yeah, you don't want to screw up the old ones.
No, we gotta nurture those ones. In any new relationship, and I'm actually in a new relationship, so we could perhaps use that as an example loosely. I found that being with this person in such a short amount of time, I've had conversations that I've never had with anyone that I've been with in the past. I've been able to be open. I've been able to be vulnerable. I've been able to be so easily expressive, and of course, she provided that environment for me to do so.
Yeah.
But when I look back, and it's only been a couple of months, and I reflect on this, it's like, wow, like you as a person, when I remove myself from that situation, you were never able to do that in previous relationships, right? Yeah. It was so difficult, and perhaps maybe that's why they failed. With a combination of other things.
So it's kind of like a welcome experience for her.
Yeah.
Yeah. She ever said like, I've never dated someone that cried so much.
I've been crying. Actually, you know what? I have cried.
Of course you have.
Dude,
there's no way you planned this podcast. You'd be like, I've been doing a lot of crying.
No, I've cried many times in her presence.
Oh, yeah?
Many times, yeah.
Like the first date?
No, it wasn't the first date.
Oh my gosh. You know what? That's putting your best foot forward.
That probably is though.
See?
That is.
You know what? We can't judge it.
That is.
If you feel like being emotional is the most critical thing, you should show her the full range first day. And then, this is what you're getting.
And just cry?
Yeah.
Like.
Well, I mean, like, it's beautiful, this restaurant. Oh it reminded me of when I was in Greece.
Could you imagine? Oh, yeah. God. But
please.
On the conversation of vulnerability, I think when you meet someone in the initial stages, I think it's very important to be as vulnerable as you can be, right? Yeah. I think a lot of times when we're dating, and I guess as you get older and you mature, things just change naturally. But if you're 100% yourself, because when we're dating is easy in that a lot of people put on a mask. They look their best. They hide their vulnerabilities. They don't have tough conversations, right? And a lot of times, perhaps the physical lust can blind some of the underlines of who people actually are, right?
Yes, because you can romanticize a relationship. Like the person could act and talk a certain way, but in your imagination, they're Prince Charming, and you're like, yeah, but even though he ghosted me for 3 weeks, he's probably dreaming about me. I'm like, yeah, maybe. But good.
And so I think to be vulnerable and to be yourself and is amazing, and it's such a beautiful thing when you experience it.
Yeah,
because I've never felt this before.
You're like an artist. I feel like that's a guy who just like plays music or paints. That's how I visualize someone, that like a guy that's like very like in touch with his emotions and like will see beauty in things and just like will pause. Whereas the average guy would be like at like an art gallery, be like, nice.
Yeah.
Eh. Huh.
And I think that's a great analogy, I think.
Yeah.
Yeah.
Are you just saying that, or are you using your psychobabble?
No. I like that.
I'm being vulnerable.
Yeah.
Encourage him.
But yeah, it's been amazing.
I want to ask about like maybe rewind a little bit to the dating, like the girlfriend search. Like, did you use the apps? And did you, like, when you looked at profiles, were you able to be like psychoanalyzing who you're?
I wouldn't say through a profile, right?
Okay. Or even just connecting with someone, meeting someone. Do you feel like you have a better intuition of their character?
100%.
Yeah.
So
what are some things you're noticing? You'd be like, that she's got daddy issues.
I think I'm a pretty good judge of character. So if I am talking to someone within like, I think the easiest way that I can describe this is being in tune with your gut. You know, that gut feeling sometimes, and no one really knows what that is.
Yes.
And I say, have you guys ever walked into a room and you feel amazing and you're happy, or conversely, you walk to a room and just something feels off, or somebody feels off, or you're having a conversation.
Yeah.
Something just doesn't feel right.
Yeah, all the time.
That is your gut. That is
too often.
And so I guess,
how fast do I leave that room?
Right.
You see papers flying.
And so meeting someone, I think I can get a good read. And I think it's important to ask the right questions, right?
What would you ask?
What would I ask?
Yeah, you said ask the right question. Is this about a date or just meeting like a professional interaction?
I think it can be applied to any circumstance.
Like even body language.
I think body language is an excellent read.
Yes.
If we attribute that to the dating world, right? There's a lot of body cues that women will give that are telling me they're interested.
I keep seeing like on social media, like when they take a picture and they have two people side by side, and then one's like linear, like, and then the other person is like this. That means this person is into that person. But if it's like this, it's like this person is into this person. This person wants to fly away.
Really? That's interesting.
Yeah, it's like, okay.
That's interesting.
We're on a date, but I don't like it.
I never even thought about that. But
and there's also a girl, I don't know if she's a psychologist, but she's been doing a lot of videos on like facial tics and facial cues. I think those are really cool because like there's the old one where like people will be like they're lying and they're like looking up, I think, to the left because they're trying to look for a creative answer.
Constantly blinking.
Or they're kind of looking around. Like there's certain things that would be like either they're uncomfortable, they don't like this, they want to get out of here, they're into you, whatever it may be. There's a lot of different schools of like analysis where people are reading into body language. I believe in like someone makes it subconsciously obvious if they want to be somewhere or they don't want to be somewhere.
Subconsciously.
Yeah, I think that they give off cues without realizing that they're giving off cues.
Yes.
Like someone who's like, you know what, like they're kind of like distracted. And they're like kind of waiting for like, are we done? But they're not saying that because it's rude. So I think there's also like masking of like, how do I want to give this person the impression I want to go or I'm not enjoying this, but how do I say it without coming off as a jerk? Because most people won't be like, this isn't for me, I'm gonna go. No one does that. People would want to, or they'll be like, there's an emergency, someone texts me, there's an escape word.
The unconscious is powerful.
Elaborate.
I agree. When you said subconscious, that kind of made me think about a few things. But based on a lot of the readings and the work that I do in the realm of mental health, right? I think subconscious is responsible for, I don't know, in terms of a percentage, 90-95% of what we're doing, right? Like we'll say things we don't mean, we'll be triggered based on, again,
Freudian slips
based on, again, past traumas, etc. And until we start to tap into the subconscious, and how do we do that? I mean, that's a big question, I think.
I think even just becoming self-aware of things that you say and do. Like if I said to someone, yuck, I'm like, oh, I don't know why I said yuck. I would like be embarrassed initially, but I would look back and be like, why did I say yuck to that? Like, where did that come from?
How many people do that?
Do what? Say yuck?
No. How many people?
To review what they said? That's what I'm suggesting. I'm like, you should analyze yourself a little bit without being paranoid.
No.
But there's a lot of people who are like, you know what? I said yes to this person for like some kind of volunteering thing. I really didn't want to, but I just said, I said, yeah, I didn't want to. I didn't know how to get out of it. I was like, well, no, you're not being authentic. Like you should say, you know what? I didn't want to do this. Because then a lot of people end up doing things that they didn't want to sign up for. And now they're stuck. I think that happens in relationships.
All the time.
Yeah.
And I think authenticity is something that is so important too. Again, in the initial stages, be your authentic self.
I have a feeling there's a lot of people who are dating and one person is way more into the other person and they just don't know how to end it.
Yeah.
And they feel bad.
100%.
Yeah. I think that's any type of relationship.
Yeah.
Yeah. But dating sucks.
Dating does.
Unless you're emotional. Unless your heart is on your sleeve and everyone else's sleeve and pouring onto the floor.
Yeah.
I don't mean to make light of it.
But you definitely have to put yourself out there and take that risk, right?
Yeah.
If you want to meet someone. And I think if you meet the right person with the same values.
So this person, is she very emotional?
Is she? What do you mean by is she very emotional?
Oh, is that your question? Is she as expressive with her feelings as you are? Yeah?
Yeah, she is.
Do you ever guys find that you're expressing at the same time?
Like talking at the same time?
Yeah, like sometimes someone needs to listen. You just both cry at the same time. Why are you crying? It doesn't matter.
Because you're crying.
I don't know. I'm just getting ready.
No, I think we've established that very early on in the relationship where she's very expressive. She's emotional in the sense that she can express how she's feeling very freely and easily. And I think a part of that is not only and just again generally is people have to provide that space for that person to do so, right? If you provide that environment where they feel comfortable and they feel that they can be honest with you and trust you, they'll do that, right?
Here's a trick question. What happens if what if she's like expressing something? Maybe we won't use your relationship as the example. Let's come up with something hypothetical because I don't want you to get in trouble. Let's say someone comes to you as a patient or a friend and they're like telling you a situation that's like, they're clueless. They're wrong. Just like, you know what, anyone could say, well, there's two sides to every story and this and that. Let's just say someone is taking a situation and it's like, you know what, I don't see it your way. How do you tell them that?
That by using those exact words.
I don't see it your way.
Or you can ask them, in conjunction with I don't see your way, help me understand where your thought process is or why you come to believe it that way. Yeah,
that's like saying you're crazy. That's the nice way of saying it.
I think.
What's your thought process? What part of the brain was? Because listen, there are times like I think we all give the benefit of the doubt too, especially patients or people you talk to. It's like this they have an issue and they're telling me a story, and then they're kind of waiting for like validation, and sometimes you just can't honestly give it.
I think you shouldn't be validating it if it doesn't resonate with you, because now that's almost lying.
Interesting.
And I think if you can't be open and honest with your partner about anything.
Oh, okay. With your partner, for sure.
Oh, right. Oh, okay.
Colleagues, friends, patients, I think is a different bubble.
Patients is a different bubble. I think colleagues are also a different level. Friends, I think that should be.
Why can't you be honest with your colleagues?
I guess you're right. I guess you should be able to be open and honest with your colleagues.
What if your colleague's your friend?
As long as politics don't get involved in that environment.
Oh no! Why? What's wrong with politics? Was that the next segment?
No, we're not going there.
Please.
But yeah, you should be.
Well, I mean, listen. I think we are in a world where you have to be cautious of what you say, and what you share,
especially now.
And
unfortunately,
yeah, I think it's always been there. I think it's just the compass has changed from time to time. But there's always been things that you don't have freedom to say whatever you want. There's always a consequence to everything.
Yeah.
I guess the idea I was highlighting was sometimes people believe something and it may or may not be true. So how do you address it if you on the outside you're like, listen, if you're all things being equal, if you just describe a scenario, I'm listening to you. I think you're wrong. How do you tell them?
And this is a patient?
Yeah, let's say they're a patient. Trick question.
That's a tough question.
I should put the Jeopardy theme back.
Because, of course, you have to trick.
Patients coming to see us.
Mm-hmm, yeah. And they might even be coming, and perhaps whatever it is they're thinking about, everyone who they've spoken to about this has said those same words, like, you're crazy, this is not true. And
I have a feeling that's not true. I have a feeling these are people that no one can tell them they're wrong. This is part of their character.
Okay, that's interesting. Yeah.
Do you are you on social media much?
Instagram.
Yeah.
Loosely.
The term narcissist has exploded.
It has exploded.
Everyone's a narcissist.
Yeah.
There's TikTok channels of people like, I'm a narcissist, and like he'll just show you and discuss all the situations of like, this is how I handle things, and this because I'm on like it's almost like a badge of honor, or it's just like a blanket diagnosis that you just paint everyone. It's like, my mother the narcissist. So, and I think there's an element of it maybe is true. I think people are very self-centered.
I think so.
I think there is a increased awareness and acknowledgement of it.
I would say so. And I think narcissism, is also a spectrum, right?
Yeah. Yeah.
And I think the ego has a big role to play in narcissism. Childhood has a huge role to play.
Yeah. How about birth order? What do you think about birth order and the ego?
That's, that's a great question, because for me, to be honest, I've never really thought about that.
Usually oldest is responsible.
Okay.
And they are kind of like the apple of their parents' eye often.
Okay.
The second is like the misfit. Okay. Because I feel like they create a duality. It's like, well, the first is like, they're so good at everything and they're the older one and they get to do everything right. I got to define myself, but in opposition of this older, perfect child. So they end up doing more like scandalous, more like opposing behaviors.
Okay.
Because it's like, well, you're good, I'm bad. You're up, I'm down. You're black, I'm white.
And so that's for two.
That's when there's.
What if there's three? What if there's four? How
does that change? The first and the third gang up on the second.
That's interesting, because I'm just as you're talking about this, I'm applying it to my personal family dynamic, because there's three, and like that mold fits perfectly of what you just described.
But it's like a subconscious psychology.
Yeah,
it's like some things that happen. Silly example. It's like urinal concept. When men go into a urinal, like a washroom and a bunch of urinals, we instinctively know which urinal to go to. If there's one person, there's two people, there's three people. There's even a meme or an app about it. You kind of know. You just sort of, everyone tries to equally space themselves out without, like, you're not going to have, trust me, if there's 7 urinals, you're not going to, if there's like 2 people, you're going to go to the opposite end.
So true.
If there's 1 and 1, you're going in the middle.
It's so true.
If there's like 1 blank 2 and there's 4 empty ones, you're not going to number 2. That's weird.
And I think that speaks to the power of the subconscious because we do that without even realizing it.
That's right.
And I think that's another good example you highlighted there. Wow.
Why did you hit your brother? He hit me. I was like, no, but that was like 2 weeks ago. I was like, well, I don't forget.
Example. I like that one.
Yeah.
I like that one.
Yeah. Actually, I have an invention.
What's that?
It's like laser guided urinals. Like you walk into a washroom, it tells you which one to go to. But it's based on like an algorithm.
Like how long people take at each urinal? How would they?
It's like to maximize the distance and to reduce the interaction of like, okay, this one hasn't been used in a long time and it's the cleanest, or this person, you're too close to that person. It's a stupid idea.
But it would probably make millions of dollars.
Would it?
Nowadays, I wouldn't put. Probably not. Maybe not that specific invention, but
I have others. You want to hear them? Maybe next time. Next time. Yeah, I mean, this mental health thing could go on and spiral forever. I mean, we get to the point where we're both crying. But what good would that? Really? Why? Would that just prove your point?
No, I'm just kidding.
Yeah, I gotta filter, so I'm gonna have like just teardrops
every 30 seconds.
You're just gonna be like a water line on your side.
Yeah.
It's puddles.
Oh,
that's okay, George the Crier.
Mm-hmm.
No, I'm just kidding. You're not a crier. You're a good guy. All right. Any parting thoughts?
Yeah, I think just to summarize kind of what we spoke about. I know we spoke about a lot of important things today, but my last thoughts for this cast would be just try to be as vulnerable as you can be, right?
That's a weird phrasing. Why do we have to be vulnerable? Is being open with your emotions considered vulnerable? Because to me, vulnerable means like you're exposed.
Well, that's, I think, true.
So it's okay to expose yourself.
To the people that love you and you can trust? Absolutely.
Okay.
Yeah.
Fair.
Be vulnerable with your thoughts.
And what do you think what's the hopeful outcome of that?
A beautiful relationship. Friends, family, colleagues, anybody.
Okay.
I think mutual vulnerability binds us.
Yes. Because you can be like, remember that time we were crying? You said I promised not to tell anybody?
Mm-hmm.
Well, I'm going to tell you. I'm going to tell somebody. If you don't do what I want, we're bound, remember? Remember you cried on my shoulder? You said, don't tell anybody? Well, I might let it slip. Sign here.
That's not good.
But I know what you meant.
Yeah. And just
laugh together, cry together.
Laugh and cry together. In any sort of partnership relationship, there's going to be lots of laughter.
Hug.
Well,
how do you feel about kissing?
I love it.
Your friends? You ever kiss your friends?
No, I don't.
You sure?
Friends.
Because I know them.
You do know them. Kissing I think is just powerful.
I think one of them is more likely to kiss than the other. We got to have them on one day.
Yeah, we will.
Yeah. Okay.
Kissing I think is powerful. Even I love it. It's such a great way of expressing how you feel. Similarly to hugging and cuddling at night, right? The oxytocin's released. Like amazing feeling.
So if someone doesn't like to cuddle and they like their space and they don't like affection, what's wrong with them?
Oof.
That's for next time?
That's for next time. Because there's reasons for that.
All right.
There's reasons for that.
Well, we'll have to find out next time.